difficult part of IVF, just like any other field, the women experience is the physical pain, and we often neglect that physical pain. Then if you take the reasons for discontinuation of the cycles, many times the physical and emotional trauma they undergo, which disturbs them and finally end up in discontinuation of the treatment. So we need to take into serious consideration about the physical pain in an IVF cycle a woman undergoes. The NFIS, the needle-free injection system, it's an innovative technology introduced by Indus Pharmaceuticals into clinical practice, and it is undergoing the trial now. And I think this is going to change the IVF scenario, the stimulation protocols, because if it is effective and it can be introduced into clinical practice, this is going to be a game changer because it completely alleviates the physical pain part of injections which they undergo during the IVF stimulation cycle. In our experience, we have conducted the trial and completed NFIS trial in about 10 patients. Definitely the patient side, the compliance was much better when you compare it with an injection system, the conventional injection system. Then all the 10 women who has undergone the trial, they are comfortable and they completely eliminated the pain which they usually undergo in a conventional IVF cycle. If NFIS, if it can be commercially available, and if you look at in the clinical practice of IVF in India, economical affordability definitely becomes the first priority among the patients. So if it is economically affordable for a patient and it is freely available in the commercial system, definitely it is going to change the IVF perception, IVF the treatment protocols, and the compliance of the patients. NFIS, it's a relatively new system introduced into clinical medicine, and we started with in pediatric age group for their vaccination injections. Now, for the first time, Indus is introducing into the IVF practice. So, NFIS is a game changer in the IVF stimulation part. Because if you take the history of IVF, initially when we started, we all had long protocols in which the patient has to undergo almost like 1.5 months of daily injection, which is the most disturbing part. Then later we changed over to our short protocols, which dramatically reduced the injection duration of the injections, roughly to 10 to 15 days from 1.5 months. Then later we introduced the pen device system, which again with a very narrow needle, which again reduced the injection, not the duration, but definitely the pain during the IVF cycle. And the physical pain is one of the most neglected area for women who undergoes IVF cycle, apart from their mental and emotional trauma which they undergo. So if we can completely alleviate the pain during the IVF cycle, definitely it's going to have a positive impact, and the confidence of the patient, those who undergo the treatment, builds up, and definitely it's going to reflect in the clinical practice in a long-term journey. And for us, we have conducted the trial in 10 patients, and it is found to be like the ovarian response, the total number of dominant follicles at the time of the oocyte retrieval, and the number of oocyte retrieved during the procedure, and the total number of mature oocytes, the fertilization rate, the blastocyst conversion rate, all of them were at par with the conventional injection system. The drug which is used in this NFIS system is Folisage, and it has got some advantage over the competitive brands. The number one is it is filled by mass. It's not filled by IU. When you use a drug which is filled by mass, the precise delivery of the dose of the particular drug is assured, and you will get an adequate response accordingly. Secondly, this is the polytropin alpha, which is used in the NFIS system as Folisage, and it is not a biosimilar drug. So it adds to the authenticity and the efficacy of the molecule.